my education hub, that is a welcome only. So I am teaching anatomy since 26 years, and it is a great moment in my lifetime. More than 5 to 6 times in front of my teacher, Dr. Varnekar sir, I am presenting because teach me repertory in final year bhms. So I am very much thankful to you, sir. What I am there, it is all small reflection of our teacher. I know since 26 years I am teaching anatomy. I know 1,000 my students became doctors in my hand. And even this institute is prestigious for me because I have given the first year to final year practical exam and theory exam in this college campus only. So I salute this institute on this big happiness. So respected management and respected director, Dr. Varnekar sir, and principal Sajid sir, and Dr. Virpakshi sir, Dr. Manjunath sir, Dr. Magdum sir, Dr. Patil sir, and physiology teacher. It is my great honor to present one important topic which is given by the director sir and Manjunath sir under the guidance of Dr. Virpakshi sir, that is the radiological anatomy. This is the one which is a lifelong you have to remember. This is not ends at the first year only, because nowadays all the Google search, every patient will bring with the reports and their conclusion. So that you should be the very master in the all the reports reading and diagnosis. So my first step in this is, that is basics of radiological anatomy. So in this first, whatever you are going to get the knowledge of radiological anatomy, when you study the first introductory lecture of anatomy, that is the subdivisions of anatomy. In that, one of the subdivision is radiological anatomy. Now we call at the advancement imaging, that is a study of the images for the medical treatment and medical diagnosis. So this purpose is very important, this radiological anatomy. So I am going to briefly guide you and make an expert on this till your lifelong. When you practice, you should know the points which I am going to guide you today. So first one, what is the radiological anatomy? When you go to the first term, that is Dr. William Rontgen, who discovered the X-ray, and this is an imaging radiology, or we call as an imaging diagnostic method. So which is helping side by side for our diagnosing and treatment of the patient. So first year you have almost all at least know how to read the X-ray, how to comment on X-ray. When you are giving the exams, you are writing the spotting, you have to comment on this. So at least you have to basic knowledge of the anatomy, you have to apply, and that we are going to comment the radiology or radiograph. So this all branch which is dealing, that is radiology, meaning concerned with the use of radiant energy. So we are going to use the radiant energy and taking the images, and that will helping us to treat and that is give the diagnosis. So that is a one. In 1800, that is a 95, where we have get the first discovery of the X-ray. So person who was by chance, by luck, he was passing the rays in the vacuum a glass tube, and by chance it is reflected on the metal plate which is glowing, and he discovered this. So that is the one discovery of that is William Rontgen, who discovered the X-ray. That is a basic you have to remember, and he got the Nobel Prize in Physics. That is 1901. So this is a very important, my dears. This is the one which is you have to remember, and where we are reaching. This is a simple X-ray radiology. We are reaching to the PET scan now. In the millimeters of changes in our body, we can record, we can diagnose. So that is the advancement of radiology. That is. So, but it is very useful when you remember about that is one term which is you have to explain, that is the visualization of signs and symptoms for the diagnosis. As I have already told, this is one of the basic diagnostic method which or treatment when we treat the radiation by cancer and all. That is a treatment method also we are going to see. So this also we can name nowadays. Previously X-ray, radiology, radiograph we used to call, but now presently we advancement in the 3D, 4D animations, so that we can call as a medical imaging. So this terminology goes on advancement and changes in that is we call as a medical imaging. So these are the words which is you can remember and understand. Next point which is you have to remember, it is a multifaceted. So multifaceted means you can use for the diagnosis, you can use for the treatment, and you can use for the study of the internal structures of the body. They are normal, abnormal. That all includes in the radiological anatomy. So this investigation, choice of finding and detection early stages. In some diseases, cancers and all, this radiology will help us to detect the early diagnosis. So this is very important. If you make the early diagnosis and early treatment in at least cancer and some diseases, they are not progressed or not becoming harmful. So that this is a very much important one for the diagnosing and treating. Next to deal, that is the interpretation of radiological images requires the anatomical knowledge. This is the basic. If you have learned total 1.5 year anatomy properly, you know what is heart, where it is situated, what is lung, what are the abdominal organ, then only you can correlate. Otherwise it is not possible. Any X-ray you can see it and without understanding. Nowadays, as it is a digital world which is developing, without some reports also we are going to get the film only by the patient. That is your testing, your knowledge test. You are giving final exam during practice also. They taken by the patients. So what we require is, we require the anatomy knowledge which is helping to diagnose the disease and treat. And I have used not till final year you should know this. I have told this you should know lifelong when you practice. And very much fast developing subdivision of anatomy is one. It's a fast developed, advanced developed. We are going to 3 millimeters of the size metastasis we can find out in the body or bone marrow in the brain by PET scan. So that all we are going to see, that is. Next, what are the procedures and all we are going to see. And one previous. Whatever the first, I have already this introduction I have given, diagnostic radiology. We can use this for the diagnosis. Intervention, you do the angiography, angioplasty, whatever radiology is required, sonography aided, abscess training to the different organs and all, that will deals to the interventional, or it is a part of the treatment we can consider. Then we have the CT scan, computerized tomography, advancement in the development. After the plane, we are going to get magnetic resonance imaging, we call commonly MRI. These all from the simple X-ray or plain X-ray, we are reaching to the PET and SPECT. And going to the, as you know, ultrasonography is there. Then we are going to have the last one more, mammography. So this is now present advancement in the PETs as we get in the positron emission tomography, as I am highlighting because it is a recent advancement in the radiology. So I have told what is the importance of this. We are going to get only 3 millimeters more than that size. We can identify from our body. No other radiology will help you. So that is the one which is you have to remember. All these procedures use ionizing radiation. We are going to classify ionizing and non-ionizing. So in these two categories, and these are the various radiological procedures, which is very important when you practice, when you learn. When examiner asks relating the radiology, we expect from in these divisions. So this is the one which is you have to remember. As we are going to get the classification where we have the imaging modalities used today. So I have told we use the ionizing and non-ionizing. We call these are the methods where under coming the ionizing plane radiograph. Then we have contrast radiography and CT. We have PETs. These all under the classification of ionizing radiation. So then we are going to get non-ionizing radiations where we are going to get that is all sonography and we have mammography. All those which are required in this category, we are going to get the classifications. So what is my important thing here to highlight you today is we are going to, in the first year basics, where we can go for the plain X-ray, how to read important plain X-ray, which are the maximum 80% to the 90%, which are commonly brought by the patient, commonly advised by the doctors, and commonly your relatives having these common X-rays in your hand. So this is I have told already, you are going to give in the practice, you are going to give the one more exam. So that here in this we are going to get the this concept of radio opacity. See, these rays are passed from the body. Some they absorb, some they obstruct, some they absorb and leave the image. This is the concept. So what is this? This X-ray anode, which is electromagnetic hitting on the tungsten in the vacuum test tube, which is formation of the X-ray. And this will giving the images. So concept will be the of radiology. You have to remember that is the most important. That will be you have to identify the normal and abnormal. So whatever the normal is there, you have to read the normal one. Then you can read normal only in the first year, but you have to correlate in the next, that is successive year. And when you go for the clinical subject, you are going to remember about the other abnormalities found in the X-ray. Okay? So this is one which is you have to remember about the concept according to the density and different body tissue that gives the different colors on the X-ray. So you have to first make the which image giving what shadow on the X-ray film, that you have to remember. So in this, when you take the with the shoulder chest region is taken the X-ray, you can see the colors on the radiograph, whatever we are going to get. First one, when we see the air, this air will be giving on the X-ray film black. It is we also call it a translucent shadow. Then we have the fat in our body deposited, that is the light, dark, black in color. bone, which is you are going to get the gray, bright gray, then white in color is the metal. So these all soft tissue, bone and metal, they are going from the gray, dark gray and white, you can consider. And whatever the air and fat which is giving you the black in color in the simple X-ray or the plain X-ray. So this is the one basics which is you can remember. Then you can properly comment on this when it is presented as an exam. Okay. Next, as this is the air where we are going to see in our body when we take the radiograph. When we see the air in the trachea, lungs and stomach, that is the intestine, paranasal sinuses. So here we are going to get the air sites where we are going. As these paranasal sinuses are limiting bones, where lined by the epithelium filled with the air, that also giving. Then so we have the fat in our body. Then we have the soft tissue like the heart, kidney, all organs which is we are going to get like muscles, and approximately they are giving the density of water. Calcification as if it is like a bone. So you have to remember this is present calcium and phosphorus, that is a skeleton which is giving the going to get maximum radio opacity is there, so that we are going to get enamel of teeth and foreign bodies. This is foreign bodies, usually coins. The patient, children's where they swallowed the small coins, that time advising the many radiographs simple where they are obstructed. Commonest practice we are going to get something they swallow either through the nose, they will put metals, all balls like or whatever the we commonly I have practicing 26 years of my practice, I have seen maximum coins and all they solve. So this is a very basic thing where we simple X-ray will give you the advice that is where it is obstructed in the upper part of the esophagus, middle or lower. So this is the one which is very important you are going to get it. Next, when we take the X-ray, we are going to take 3 methods maximum. We are going to view the 3 methods. One is we are going to get the AP view, anterior posterior, posterior anterior and lateral. So what is the meaning of this? If you want to visualize the anterior aspect of the part of the body, you have to take the PA view. Then you want to visualize the posterior structures of the body, you have to take the AP view. And we are going to get the lateral view. Just simple presentation, you have the one which is you get the X-ray, and here X-ray beams are passed, but this is a cassette which is consisting the X-ray film. So one which is a PA view, rays or beam passing from back to front, but this cassette which is consisting the X-ray film, and this is we are going to get the highlight of the anterior view or anterior part of the body. So that we call as a PA view or PA chest. So next, AP view anteriorly, but we are highlighting this is cassette which is consisting the X-ray film. Posteriorly we are keeping rays or beam of X-ray passing from front to back. We are going to visualize that is the back part of the body. Then we are going to get the lateral view, which is you are going to get the any angle which is anterior posterior, not we can call oblique or lateral view. These are the views where laterally, right lateral or left lateral, we can take the imaging. So this is a simple methods which are we are taking the X-rays, simple X-rays or the plain X-rays. So this is a one X-ray which is brought by the patient to you, and what you are going to observe, or it is kept for the spotting, how you are going to comment on the particular X-ray, or when you are going to write about the X-ray. First you have to think in the first year, you have to think the whatever the normal, don't go for the any abnormal comment in the exam at least, unless and until it is highlighted by the examiners. Only you have to first basic is that read and find out and comment relating the that is the anterior or whatever the simple X-ray normal anatomical structural related. So this is the one which is you have to remember. I have represented this. Here you can see the aorta and pulmonary trunk. Here we have the left auricle. This is the left ventricle. You are going to get the right atrium, and here we are going to get the superior vena cava. So these are the areas, these are the structure you have come across when you have studied the heart. So that if you know these all structure and its location, then only you can comment on this. This is normal, but how to read X-ray, you are going to get the. So this is a simple guidelines which is you can remember, because all the areas I have told, aorta we have told, pulmonary trunk, auricle, we are going to get left ventricle, you have the right atrium and superior vena cava. You also trace the trachea. So these are the areas you have to remember. It is kept in your mind, then only you are going to read the PA chest, whatever the X-ray. Most commonly till final year, we see that the reading or the diagnosis of the PA chest is not done properly. So that if you are studied properly PA chest, according to that you can go for the other related comments. So this is the one which is basic thing which is I am going to highlight today. How to read and how to comment, that is all. So when you see the PA chest, what you have to see, check it. So expected things from the examiners or in the practicals, in the spotting, is these points. I know that is National Commission has made the spotting and 2 radiology is fixed question. So 5 marks each. How they have divided? 5 marks is 1, 2, 2. So in the one question you have the 3 subdivisions. So identifying the X-ray is 1 marks. Then writing the what it is a type and its description is 2 marks. Then third you are going to get the details. If the normal structure seen in that surrounding X-rays, that also you have to write. So anatomical structure, normal, which are there, that you can see. So this is a very important one where you can comment on the PA chest. So what is important first, you have to check on the X-ray film, you have to check the name of the patient and which radiograph it is. It is AP view or PA view or lateral view. So next, when you read the date of that X-ray which is written, now even the patient name is printed on the film. Next, identify the type of film which is used. Now we can use the paper film, digital, whichever it is there, but we don't have the all medical waste like that we are finding now. It is printed in the file with the A4 size paper also. So look for the markers, any marks on that, and technical quality of film, then external soft tissues which are seen in the chest X-ray. So this is all I am going to guide you. You have to see these all heads in the reading of the PA chest till final year. So this is the one where domes of diaphragm, you can see gas bubbles are seen in that you can see. Then free air is there. Bones, what are the bones seen in the PA chest? That also you have to remember. Spine, clavicle, scapula, humerus. If it is exposed till to the shoulder joint. So this is the one which is the basics where you are going to see in that is the PA chest. So how to read the PA chest. See, these are the few important I'm going to show the radiographs, plain radiographs, where you can see and what are the things you have to remember. Whatever I have told, the region where you have to see first. So instead of going to the labelings, as you are knowing all the parts and location of the structures or the organs of the body, first I am going to give you the guidelines to read comment on PA. First you have to see the cardiomediastinal region. So when you see this cardiac shadow and mediastinal region, that you have to see. Means cardiomediastinal structures. Second one, pulmonary structures. You have to see on the side of the heart, lung is situated, lungs are situated. So these right and left lung you have to see, that we see or call as a pulmonary images or pulmonary area. Next we are going to see the vertebral column. Then we have the bones, ribs, all that can be, you have to find out in this. So here we have to see the clavicle, trachea, vertebrae, and this is the one which is a heart shadow. And I have told you have to very much specific to see the domes of the diaphragm. We are going to get here left dome of diaphragm and right dome of diaphragm. Here we are going to get in the fundus of the stomach, we are going to get the gas shadow. So this is the one which is a normal thing which is we require. And this is the one PA chest where you can remember about that is the first one, that is the reading of the PA chest. I have told that is you have to highlight or first concentrate on cardiomediastinal region, means heart and its structure related. Then you have to see the pulmonary area, lung. Then I have told the vertebral column posteriorly, trachea. Then we have the clavicles and ribs, both the sides. So this is one simple thing which is you have to know and see these all areas when you are reading the PA chest. So next, when lateral view is taken, so just you have to understand the lateral view of chest, where you can see the heart shadow and ribs, sternum, where you can see the highlighted sternum, trachea, lungs we are going to get, and all the vertebral column we are going to see. This is the one which is a lateral view of chest. Next, which is you have to highlight, or in the females, when we take the X-ray chest, it is we are going to get the shadows of the mammary gland. So this should be interpreted properly with the one of the content which is we are going to get fat maximum in the mammary gland. So that should be shadowed here and you have to identify. And below this we are going to get the domes of the diaphragm, and this is the cardiac shadow or cardiomediastinal structures. So this is the one which is you have to comment. So when we see the view on the superior and as it is a PA chest, as we are going to get in the CT, thorax and all, this is the one abnormal where you can see that is the applied anatomy. In that we have come across the clinical anatomy of the lung, where we have the tumors or any region which is occupying in the lung, that we are going to get, it is seen like in the white shadow, that you have to, this is the abnormal one. Okay, so this is the one which is a PA chest, which is on the superior, we are going to get it. So this is also same, apex of the heart we have to concentrate where it is situated. Is it cardiomegaly is there, then we are going to get the heart shadow is enlarged with the apex which is going towards the chest wall laterally. So cardiomegaly you have to remember, COPD we call chronic obstructive lung diseases, where we have the narrow chest and lung shadows are narrow made. Then we sometimes we are going to get the tube-like heart. So this is the one clinical anatomy which is you have to compare in the clinical anatomy of lung. So as these all parts highlighted, PHS, most important, what you have to see, all these, which is areas I have explained you. So you can read better PHS and see what is a normal and abnormal. So this is one view which is commonly kept for the exam. Then you have to how you are going to comment on this. No labeling, nothing. When this X-ray is brought by the patient, you have to see all the shadow normal. First, you have to think in the first year normal only. Don't think comment going for the abnormal one. So first year, you have to basic one is you have to remember about the normal anatomy. So here you have to see tracheal shadow, vertebral column. Then we see the heart shadow, lung shadows which are there. It is my department view box X-ray I have taken. Usually we keep for the spotting and all, and that is a Vichy. Here you can see the dome of the diaphragm, gas in the fundus. So this is a normal PH chest. So in this kept for the spotting, how you are going to write the points? First you have to tell it is a plain radiograph or we are going to get the PH chest, which is showing the following normal structures. One is cardiomediastinal and lungs, pulmonary area, cardiomediastinal structures. Then bones, including clavicle and ribs, you have to highlight, and vertebral column. So this is the one which is including the domes of the diaphragm. So this is the one which is you have to comment on the PA chest. So this is the basic of the PA chest we have completed here with the kept common specimen in the total spottings and in the exams. So this is the one which is when we go for the applied anatomy, we have taught you what is a pleura, covering of the lung, pleural effusion. I have shown you the normal all. Here the white shadow which is filled with the fluid which is giving the pleural effusion we call. So don't think or comment that is a cardiomegaly here. Should not be mistaken this as a cardiomegaly because you have to see heart shadow, even little part of the pericardial effusion as well as we have the pleural effusion. So abnormal collection of fluid in the pleural cavity, pleural effusion, abnormal collection of fluid in the pericardial cavity we are going to call as a pericardial effusion. So this is just clinical anatomy of heart and lung and pleura. So this is what I am applying the clinical anatomy in relation to that is a radiological anatomy.